Hi, I'm Dr. Charis Chambers, and you're watching Body Language, a series where we have candid conversations about women's health and anatomy. Because it's 2026, and our bodies shouldn't be mysteries anymore. I'm joined today by Dr. Karenne Fru and Bailey Taylor Brown.
Hi, ladies. I am so excited to be here with you guys. I mean, I'm honored to be here with you guys, but I feel like we're here to talk about something that is so important, our bodies. And diving in even more, our periods, because matter of fact, I'm on my period as we speak, and it is doing a number on me. Oh, sorry. And I feel like I want to dive in and ask so many questions about my period, about birth control, and just what I need to be aware of to make sure that I'm making the best informed decisions with my doctor. So I think my first question is, I'm 29 years old right now, and I've been on birth control for about 10-ish years, on and off, a few different brands, but just taking the pill orally. Mm-hmm. And I just feel like at this point, my period is kind of getting a little bit worse. I've noticed that symptoms are worse. So what would you guys say is a normal period, or what should I be looking for to be like, all right, this is a time for you to have a conversation with your doctor and take it from there and look into different contraceptive and what you should do that way. Yeah. So what does a normal period look like? Tell me.
I love that question. And I think the world would be better if we understood the answer to that question. Correct. So a lot of my counseling with patients hinges on what is normal and when does that transition to abnormal. So when we think about normal periods, we typically think about when they first start. So normal onset of periods is around the age of 12. The range can be from like 9 to 15. And so you find people kind of placing abnormal labels on themselves because they started their period at like 10. And you're like, hey girl, that's still within the normal range. So 9 to 15 is the normal onset of periods. Around that time, we typically see someone having bleeding every 21 to 45 days. That's in adolescence. As we get older, so around 29, that's going to be every 21 to 35 days. We don't want you to have bleeding longer than 7 days. 7 days of full flow bleeding. And then the other symptoms are related to like pain, for example. A lot of people think that it's just normal to have really bad pain with periods. That's not normal.
I'm like, I need to know. I'm like, let's dive into that further because I have horrible pain. I feel like it's not even manageable with just over-the-counter like pain medication. Mm-hmm. So it's like, when does that become a conversation to look into different birth control methods as well?
So typically when you get to the point where it's not manageable with that over-the-counter pain medication, that's an appropriate time to bring it up with your doctor. I care mostly about pain that would prevent you from doing your daily activities, from showing up at work or school or dance or whatever you do as your full capable self. So anything that inhibits you from showing up fully, be it pain, be it bloating, the excessive amount of bleeding, even mood changes. I care about all of those things, and I feel like they should prompt a conversation with your doctor.
Yeah, that makes sense. I
was waiting for her to finish because I was going to jump right in, because what I remind people, the conversations I have with patients presenting, and the conversation you really should be having with your doctor annually, meaning every single time you go in for a checkup. We recommend annual checkups. You should be talking about the length of the period. For some people, 7 days is typical in their family.
Okay, wait, because that is where I am. So I started off, I think when I was younger, I probably on birth control it would be 3 or 5 days. And now, as a 29-year-old, my period is 7 days long, very heavy, tampon, pad. I am frequently changing it. And like I said, my pain is very unmanageable. So I guess my question is, what kind of conversation do I need to have with my doctor?
The conversation should be, I'm in pain. Pain is the 5th vital sign.
Yes.
Things we do to you should not be painful. Things that happen to you should not be painful. Periods should not be debilitating pain to the point where you can't do your life. So if you're having to think about your period and altering your schedule to account for the discomfort.
I'm not leaving the house during my period.
No, see,
I'm here today, but I'm normally
call your doctor.
Yeah.
This is the second you start being, I have to stay home because I need my heating pad and I need to be near the bathroom.
I'm on my period. I'm on my heating pad. This morning, I was doing my makeup on my heating pad because it does just feel that intense.
Yeah.
And so I guess my question to follow up with that, when you're taking, because honestly, I'm going to be so honest. I feel like I'm very uneducated when it comes to my period and ovulation and all of those things. Just like my background, I'm thinking of health class from when I was in high school. I'm like, I don't remember them even really diving into that and like what we need to
didn't.
they definitely did not. And diving into like, what's normal? Is this okay? Like you need to, I don't know, go to the hospital, whatever it might be. And so if I'm obviously taking the oral contraceptive pill, but when I'm taking it, if I take it at an hour late and it's a day, like what are the signs where I could be, or is there even signs where I could be worsening my period with the birth control, or is that just a myth? I feel like I'm always in my own head because I feel if I'm not taking my birth control at the same time every single day, I'm possibly making my symptoms worse, or it's doing something to my body. And honestly, I would love to hear what you guys think about that. What the true, what is right and what is wrong in this way.
Yeah. So
I was like, I know. Okay. Yeah, you take yours.
Okay. So my PhD is actually in ovulation.
I love that.
Yes.
So I completely nerd out about this. But birth control pills just manipulate your ovaries into being quiet. So if you're taking combination birth control pills, so it has some estrogen, it has some progesterone, that is the most powerful form of a pill, and please lessen your anxiety because you don't have to be taking it on the same second of every day. Who's got time for that?
Right, and your ovaries do not have
I
a clock.
don't. And you're traveling.
No. You can maybe relax a little.
Okay.
You do want to take it every 24 hours approximately, if it is the combination pill. The one that has less of a suppressive effect on your brain and will cause breakthrough bleeding, which is the thing you're afraid of, is the progesterone only pill. So knowing what kind of pill you're taking
is important.
Actually matters.
Okay, I just realized I actually don't know what kind of birth control pill I'm taking. I'm like progesterone combination.
And this is important too. And I would just to interject, doctors should be explaining that. So I explain that to my patients because when you are explaining their options, that is a key distinction. Is this a progesterone only option or a progestin only option? Is this a combination option? Because they act on your body differently.
Correct.
And your responsibility is different. And so you can actually be more relaxed around the timing with which you take it because potentially we need to verify this. You're taking a combination pill. Does that make sense?
I can get it for you, and you can. It's actually funny as we're recording this. It's about to be my time to be on time to take my pill, but I actually have no idea.
Yes, it matters.
But the other thing that I wanted us to have super, super clear is that ovaries should not be active if you're taking your oral contraceptive pill correctly.
What do you mean by ovaries being active?
My number one favorite question. So your ovaries, their job is to grow a follicle with an egg in it and then release this egg so that it has an opportunity to get fertilized. That's ovulation, right? But with birth control pills, your brain stops sending the signal to your ovaries. The thing that is causing the bleeding that you see is a withdrawal, meaning when we expose you to the estrogen and the progesterone, the hormones in the pill, your lining, which is the endometrium, the lining on the inside of the uterus, grows. And then when we take away the hormone, it bleeds, it sheds.
I'm learning so much.
So all we're doing is controlling this dear, sweet, dumb organ called the uterus. We are telling it when to grow lining and when to shed. That is it. You see the bleeding. It looks like a period, but it's
not really a period. I know, which is so insane, right? So
okay, yeah, this is my mind
panic.
is like being
Don't
blown
panic.
right now. I'm like, what do you mean?
Don't panic. And so, yes, it still can be a reliable sign in some cases that makes people feel reassured, like, okay, if this lining shed in this fullness, the likelihood of me being pregnant is less, right? Is it perfect? No. But when they actually introduced that withdrawal week or that placebo week to the pills in the early 60s, it was added for social reasons.
Correct.
As in, it was more socially acceptable, and thereby more people would be likely to use contraceptives if they had that monthly predictable bleed. And so what we're doing is signaling to the uterus, here are some hormones, okay? And then for this little placebo period, we withdraw those hormones. Correct. For many of my patients, once I explain that, I say, now, do you want to have this? Because it is optional. It is my favorite thing to talk about what is optional.
Okay, because I was going to ask this. I was like, because for a little bit to dive into my health issues, but I have low iron. So for a while, I had doctor-ordered period skips for me to skip my period. And I kind of thought period skips was something that people in college made up so that they wouldn't have I was like, they're making this up so they don't have to have a period on spring break. I was like, there's no way the doctor would order. I mean, and I didn't realize that it's okay to skip your period.
Yes,
I didn't know. And I also, I mean, a question truly is, if I do skip my periods, is it going to mess up my fertility for later as I'm 29? I'm not ready to have kids now, but that's a thought in my head. I'm like, I haven't had a period in 3 months. Is this going to mess up my likelihood to have children in the next 10 years?
No.
In summary.
Quite simply, no. Because what is happening is the pills, like I said, they're only working on your uterus. They have made your ovaries go into early retirement. They're just hanging out. They're like, we don't need to work. So you don't actually know how that system is functioning. So when people come to me and they're on oral contraceptive birth control pills by mouth, then I have to tell them to stop taking it so I can see what is really happening with them. Mm-hmm. And that way, we take away all the external pressure and we let the brain wake up and go, oh, yeah, there was this thing I was supposed to be telling the ovaries to do. Let me do that. And then when they resume actual period bleeding, we measure the hormone levels to make sure that we still have a nice loving relationship between the brain and the ovaries. Because when you're on pills, it's masked. You can't tell.
Yeah.
Unless someone is in ovarian failure, which is the brain is yelling, ovaries not listening. That will affect your fertility.
Yeah, but to kind of echo that sentiment, the idea is the medication, when you're taking it, is doing its job, right? But there aren't like long-lasting effects. When you stop taking it, or even when you miss a few, when people get pregnant, because that's the whole point, right? It's not around in your body in this forever sense. It's something that you have to take on a daily basis because your body metabolizes it and it gets out of your system. And so there isn't long-term fertility, impairment because of these pills.
See, and I feel like that is like a debunk. I needed to debunk because I'm like, there's no way that this can be okay. But I'm also, obviously, I've talked about how horrible my periods are. I'm like, it doesn't make sense for me to always have a period because it's very debilitating.
So if you were my patient, I would be interested in a workup of like, hey, what is the cause of this pain? Right? You've described that it is debilitating enough where you have to alter your day-to-day and maybe not even leave your house and do all these other methods, and you're already on a hormonal method. So the idea is like, why? I think the things that come top of mind would be any structural issues. So sometimes we do that just by getting an ultrasound to look at the structure and shape of the uterus and ovaries to make sure we're not missing like an ovarian cyst or something like fibroids, polyps, things of that nature. But the other piece that I'm always considering for someone who has really bad pain is something like endometriosis. Mm-hmm. So endometriosis is a chronic inflammatory condition that is estrogen dependent, that is something that progresses over time. So in the case of someone that has endometriosis, being on hormones can be helpful because it can suppress the progression of that endometriosis, but it doesn't always address the full symptoms. And so it isn't bad that you're on hormones, but you may need something else on board or like dual methods to improve that pain fully. And endometriosis, especially untreated, can certainly impair fertility.
As we're literally having this is seriously my birth control alarm that goes off every single day telling me that I need to take my pill. And I'm going to stop it.
Take it.
And I'm going to take it. And I'm honestly going to ask questions so that now you guys can tell me, Okay, ignore that I'm not taking this with water.
That's okay. We'll hide.
But you guys can tell me if this is combination or
if
this
it's progestin only.
Yeah.
Okay. So it's a combination pill.
Okay.
We love this.
We love those.
And the way you know, so for anyone, you can look at your pill pack and see if it's combination or progestin only. The combination is going to say one name and ethinyl estradiol. That's going to be your combination, or estratrol or whatever, right? But the first name is the progestin, and then if it has a second name, that is your estrogen or your estradiol. So you're on a combination.
Okay, good.
Congrats.
Okay, good. Okay, now actually an even more deeper question. Are these necessary for me to take when it's time for my cycle? Can I pop them in the trash? Do I need to take them? What's the point of them? I know sometimes they have iron, so for someone that's iron deficient, it makes sense. But why are they there? Do I need to take them?
They're quite literally there to keep you in the habit of taking a pill at the same time every day.
Yes.
Because if you are me and you pop those into the trash, the day when I'm supposed to resume the active pills, I don't remember.
Right. Some people don't.
Yeah, so it's a visual cue to keep you in the habit, so you get to the end of the pill pack and go, oh, I need a new pill pack. And then you start at the beginning again.
Because see, I thought that if I missed the placebo, I may need to like backtrack or make up. So I had no idea. I was like, what? Well, and I didn't know they were placebo. You know, we called them the white pills. I'm like, I thought if I missed the white pills that I'm messing up the cycle, that I need to restart the pack. It's like, it's so insane.
It doesn't have any of the active ingredients in it.
You learn something new every day.
Can I see your pill pack?
Yes, please.
So when I'm prescribing something to a new patient, I try to pull out the pill pack to show them this as well. There's new guidance that this row here, the placebo pills, this is actually the part where if we don't follow back up and start that new pack after that, you're most likely to get pregnant. So if you're using this for contraceptive reasons, it's really important. That first pill in your pack is the most important pill to not miss. And so for someone who's really toying with the idea if I need to take these pills or not, as Dr. Fru mentioned, if you are not certain that you are going to restart those pills when you are supposed to, just take the placebos. Just continue the habit of taking it every day, because you can put yourself at greater risk for unintended pregnancy. Not to scare you, but just to highlight that is the area of greatest vulnerability.
Okay, see, because this is actually important for me, because I was told, you know, as you're told many things, that even after this, it doesn't matter when you can start your birth control, you can restart your new pack a few days after your period, and I don't want to be susceptible at this moment. I did not know that.
So just so some people's pill packs, I'm just holding this for visuals, is that some of them will have 7 placebo pills, right?
Correct.
And so there's an opportunity to have 7 or 4. What we now know is that 4 is more protective, because the more of a release or the longer your break is from those suppressive hormones, the more likely it is that your ovary is going to start forming that new follicle and then releasing that follicle, which is the process of ovulation, which is what makes you vulnerable to pregnancy.
Wow.
So
I'm literally mind blown right now.
No, it's a lot. We're preferring the 4 pills in the placebo pack over the 7, but
Correct.
certainly going beyond 7 is just playing with fire.
Okay, so, and then my question to go into this is, there has been a time where I've had a conversation with my doctor where she has suggested that I think about getting an IUD. And well, part of the reason is because I was not taking my pill at the same time, which now we've obviously debunked. But I do feel like for me, an IUD makes more sense, and I would love to really dive into when maybe if you are taking contraceptive pills, when you should consider then switching to an IUD for your lifestyle. What's the purpose?
Oh my God, IUDs are my favorite form of contraception.
It's like you're not supposed to have a favorite child, but then you kind of do.
You kind of do, because there are individuals, especially young people, especially me when I was in college. Dear God, it was so distractible. There was so much stuff to do, right? Life is busy, and you don't want to be stuck to a pill pack with an alarm every single day.
Yes.
You could put an IUD in, and it is years of protection, as protective as women who get their tubes tied.
Yes, which is wild.
Let that sink in. So it is convenient. It's one procedure, and then you're protected from getting pregnant. The infection risk, there's a myth that it is increased. It is not. There's a myth also that it causes infertility. It does not.
Does not.
And the best part is that for people who, for one medical reason or the other, cannot be on birth control pills, the oral pills, an IUD is safe and effective.
That's me, actually. So one thing I think is important to highlight is when you say IUD, that's called an intrauterine device. That's what it stands for. And so there's multiple types of IUDs. The main categories are those that have hormones and the one that does not. And so the one that doesn't is the copper IUD. We really like that for folks who have complex medical histories and they cannot take hormones of any type, but still need really good contraception. The kind that we typically kind of boast about is the hormonal IUD. And the reason we boast about it is because it gives progesterone right to the uterine lining. And so it can make periods significantly lighter. It can make periods actually go away. And so for folks who have heavy menstrual bleeding, the hormonal IUD is indicated for use in those patients.
Correct.
So as you highlight your period being quite heavy, that's a major improvement that you could see because the IUD gives medication locally. It also doesn't interact or have what is that called?
So the birth control pills work
Yes.
on your brain to quiet your ovaries. The IUD simply works on our sweet, sweet, dumb organ, the uterus.
I think the uterus is actually, I don't think it's that
I
dumb.
think the uterus gets smart when it has a placenta in it.
That's fair. But it doesn't interact with your other medications. So a lot of people may be on a ton of other medications, and it might make it so that that birth control pill is less effective.
Yeah, because I was just thinking when you take
Yes.
certain antibiotics, they will literally tell you your birth control is weakened. And I'm like, I don't know.
And
what
that's
that
not the
means.
case for many antibiotics. The majority of antibiotics that we're taking do nothing to your birth control. If you're taking rifampin, right? Like, why would you be on? Why?
Well, heavy duty stuff.
I know.
I mean,
too.
life happens.
If you're on really rare antibiotics, then yes, that can be an issue. But even that is a larger myth. The majority of the antibiotics that people are taking are not negatively affecting their birth control.
Correct. If you're doing perfect use for your birth control.
Correct.
Meaning taking it every day.
Every day. I feel like I would be the perfect candidate for an IUD, and it's definitely a conversation that I need to take to my doctor because it feels like there's so many different ways that it could help me. And to touch on just the fertility aspect, I think something that, I mentioned in 10 years, I would love to have children.
Yes.
And I think a lot of times, at least I feel like people that are my age think, oh, I need to get off birth control to prepare my body to have children for years so that it can flush out of my system. And I feel like, I would love to get guidance on that. Is that even a real thing?
No, it is not. No,
I knew
no, it is not. It is not. It is not. So with an IUD, you could leave it in and I can freeze your eggs.
She did that actually for me. She froze my eggs and left my IUD in place because I wasn't
I'm
ready
writing
to
this
have
all
a
down.
child.
Like you don't need to take out your IUD to freeze your eggs, and your IUD is working again on the uterus. Your ovaries and your brain are going on about their business in the background, unbothered by the fact that you have an IUD. So I take it out. I go
Immediately fertile.
You're immediately fertile. Like
Oh, when you take it out.
oh yes, the day I take it
Immediately.
out.
Okay.
If you're not ready,
That's
to
good
be
to
a
know
parent,
too.
Never mind. I had one period. She took my IUD out. I had one period and was pregnant like this. I told my husband, I was like, no, it's going to take some time, sweetie.
No.
I'm a little bit older. No. I looked at I said, I'm sorry. Are these pregnancy symptoms? I know I'm a doctor, but I've never been pregnant before. Pregnant like this. Now, I'm not, that's obviously an individual story, right? But the science backs that up.
Correct.
There is no prolonged effect. So once you get that IUD removed, you're good. But I think there's also, people are talking about like oral contraceptive pills, that they need a washout there. So I think that's something you could address.
Okay, so because the oral contraceptive pills work, again, on the brain, then yes, you do need a wake-up period.
But how long?
But it doesn't need to be 2
oh,
years.
no,
it doesn't
it is
need
not
to.
2 years.
I'm like,
It is not
I
2
want to make sure
years.
that I'm still fertile. I'm
no.
29. I don't need to stop taking my birth control
Okay,
now.
you stop
to make
your
sure.
birth control pills and your cycles resume and you're not using another form of contraception, you will become a parent. So if you were my patient and you had been on birth control pills, and we need to see what your system does once we stop it. If we stop it and 2 months go by and you have not had a period and you have not gotten a positive pregnancy test that we know of, then we've got to start doing some investigation, because your brain typically is begging to wake up and tell your ovaries what to do, which is why the 7 days of placebo pills is dangerous, because it's just enough time for you to recruit a follicle.
But like, okay, for me, let's say that I'm like, okay, it's time for me to try to conceive. I don't have to stop earlier than I'm ready to conceive. I can
Correct.
just stop, right?
I
Because
just
some
stop
people's-
when I'm actually ready to conceive. I don't need to
Correct.
give my body this in the middle ground.
No.
I'm like I feel like I
No.
saw a video online where they were like, if you want to get pregnant in the next 5 years, you need to give your body 2 years of being natural. I'm like,
Unless you are
that's
ready
scary.
Unless you are ready to be a parent,
I'm not.
do not stop
Yes.
your contraception.
Don't do it.
Your system, you don't know when it's going to wake up, and it could happen like that. And then
Right.
you're pregnant ahead of schedule, and well, there goes your careful
And
planning.
then that's what it is.
But to backtrack to your question about, is an IUD a good choice for me because of you already being on birth control pills? You cannot use an IUD if there is a structural problem inside the uterus.
Right.
And one that tends to plague a lot of Black and brown women is fibroids. So if there's a fibroid sitting inside the cavity, like it was for my sweet patient, I can't put an IUD in her.
No, it's like completely contraindicated. And so
Yeah.
that's why looking at the uterus and getting something like an ultrasound is really important. And I think people need to understand that that is a minimally invasive study that we can get and that people should be, in my opinion, asking for.
Yeah.
Like asking for, like, does the structure of my uterus look like before I just add more pills to this, before I just, warm up my heating pad again? What am I working with?
This
right?
feels like something I need to take to my doctor, because I think it's
Correct.
probably been maybe 5 years since I've had that type of ultrasound to
Yes.
check what's going on down there. So I feel like that is an important conversation, because I'm getting a PAP obviously once
Yeah.
a year. And it's also like, if I'm still having these symptoms, maybe it's something where I do need to dive in deeper and have those deeper conversations with my doctor.
Absolutely.
I was also going to suggest an ultrasound study called a saline sonohysterogram, because that will actually show you what is going on inside the uterus.
Right.
It might, if you do a regular ultrasound, it will give you some information. It'll tell you whether there's a fibroid or not a fibroid, but it won't necessarily clearly show whether that fibroid is inside your uterus, where it might be a problem if we were going to try and solve the problem with an IUD, for example, or if it's in the wall of your uterus.
Yeah.
So if you need the problem, examined as completely as possible, especially you bring to your doctor's attention, I'm actually having worsening symptoms on the treatment you typically give for these symptoms. I would say that a regular ultrasound is just the minimum anybody
Yeah.
could do.
Yeah.
It's a starting point.
It's a starting point,
Yeah.
but it needs to
It
go
needs
at
to
least
go
one
further.
further
Yeah.
before you're certain that, yes, if you choose to go with an IUD, you're making a reasonable choice and there isn't some reason why it won't work.
Yeah, and I would say, and this is just important for anyone, if your imaging is normal, it doesn't mean you don't have pain, right? It doesn't mean that your lived experiences and your symptoms magically go away. And I tell my patients, I'm ordering this to better understand your pain, not to prove you have it. I believe that you're
Yeah.
in pain.
Correct.
Right? And so
Correct.
a negative ultrasound doesn't mean, or normal ultrasound, it doesn't mean you don't have endometriosis. It doesn't mean you don't have a polyp or a fibroid that they just can't see very well. There's so
Yeah.
many other things at play. And so we try to get imaging to get a better understanding. But if it's not clarifying enough, it doesn't mean we stop looking or that your pain or your complaints are no longer valid.
So personally for me, I have seen lots of doctors in my days, and this is something I want to bring to you guys just from my personal experience, but for me, it has been really important for me to have a doctor that is brown or black, that is a female, so that they can understand. I'm thinking of this instance where I literally went to the doctor to retouch on some autoimmune issues, and my doctor was very dismissive of my pain. He was like, "You look healthy. I don't think anything's wrong with you," even though I've obviously had many markers in the past that share that there's something going on that we need to dig deeper. So I think my question for you guys is, do you think it's important for Black and brown patients and women to really be selective about the doctors that they're choosing and really do research? Because I feel like I was referred to that doctor, so I just went to the first doctor I was referred to, and it felt so dismissive after our appointment. I literally remember I just bawled my eyes out. I called my partner, I called my mom. I was just like, this is the worst feeling ever, having someone make you feel like you're crazy for your pain, for your symptoms, for what you're going through, or even equating it to being like, I think you might have some kind of like mood disorder or something. It's like, no, these are serious issues of what kind of pain I've been experiencing for a long time.
Yeah, usually at that point I say switch doctors.
I know.
Because our entire job is listening. If you listen closely enough, ask enough follow-up questions, the patient will tell you what the problem is.
Yes.
Our job is pattern recognition. We put the patterns together and then we form a solution that we can collaborate on, something that works for you, right? And the problem that the patient comes in primarily should be addressed. Maybe it can't be addressed in one visit, but we should be making progress towards that answer.
Yes.
Period. That is our whole entire job.
But just to a few quick things. One, I just want to say I'm sorry that you had to go through that, right? Because just mustering up the courage to make that doctor's appointment, to go in and say, these are the things I'm experiencing, to get your hopes up that maybe someone will hear you and have some sort of guidance or understanding that will lead to a diagnosis and lead to treatment and lead to relief is such an emotionally vulnerable place to be in. And I think that we have to be very, very careful about where we go and allow ourselves to be emotionally vulnerable. And so you should be highly selective of your doctors. You should be more selective of your doctors than even maybe your friend group, right? Like, I mean, this matters greatly.
Yeah.
And when I say that, the idea is that you come to your doctor being the expert in your body. The doctor is the expert in medicine, and it is a collaboration of experts that gets the best outcome. If one expert completely dismisses the other expert, there was not a collaborative process.
No, it wasn't.
And you can't work with those people. Now, saying switching a doctor, it sounds simple, but in the world we live in, with limited insurance coverage and accessibility, that can be really challenging. It can also be really challenging for someone to find a doctor that looks like them.
Yeah.
Black women are 2% of physicians, right? That's not a lot. So if we set that as the mandate, it's not going to be an overarching solution. The solution is that we have doctors who listen to and trust and care for Black women and brown women appropriately. It is not good enough to say that because you are a Black woman doctor, it is your responsibility to heal the people that look like you, right? I love
It's
that.
a daunting task.
But I can't do it. I would have to clone myself, right? And so we welcome more diversity in medicine, but the standard has to be raised for other doctors that don't look like us to believe women that are walking around in our skin and know that we are worthy of good quality care.
Yeah.
Yeah, there are not enough doctors that look like you.
They're
and
just
me.
not.
They're not. But
It's good, but it's not good enough.
Yeah.
Your doctor should always listen. You are part of the solution.
Yeah,
You're
have
bringing the
answers.
problem to our attention, but you are also actively part of the solution. It should always feel like partnered care, shared decision making.
Yeah.
And when I say switch
And also maybe
doctors,
discussing different, what was I thinking, outcomes, discussing different treatments, different solutions, different plans,
Yes,
everything. And
correct.
Yeah,
It
it's
should,
really hard.
If the first solution is like, no, thank you to you for whatever reason, just say that. No, I don't think this is going to work out for me. I'm going to forget. Can we try something else?
Yeah.
And the two of you should arrive at a solution that works and honors who you are, who you walked into the office as.
Yeah.
Because we professionally listen to people complain.
Yeah.
So when a patient comes in and I go, how you doing today? And they go, fine. I'm like, why are you here then?
Yeah, you're like, I'm here to listen to what's going on in your body
Yeah.
and what you're going through
Like,
and what your hopes
your job
and
is to
plans are.
complain. Yeah.
I do think there's another layer here, that there's a trope that Black women have to combat on a daily basis, that we're not difficult or ungrateful, and all of these things that we get labeled with. So as a physician, I came down with an unknown kidney disease, like literally in my training. And I asked for a renal biopsy because they didn't know why I had it. And so that was the next appropriate step. But I had to advocate for it. And I wasn't being ridiculous. I didn't say it had to happen today, but that makes the most sense because you can't tell me why this is happening. And the nephrologist, the kidney doctor who was on call that day said, do you enjoy being difficult? I'm a whole physician, right? And so I'm like, being labeled with being difficult when I'm just advocating for myself is such a fear. And many people, for fear of being labeled as a difficult patient, as an angry patient, as a patient that people don't want to take care of, we kind of come in and we try to be on our best behavior. We do like this respectability politics where we wear our best clothes and say, I'm in college and I have this degree, to say I'm a worthy person. Like, don't dismiss me.
Yeah.
And I hate that we have to go into these clinical encounters campaigning for our worth.
Yeah.
Because that makes that burden so much greater. I can't just even talk to you about my symptoms because I have to make a case that I am worthy of being treated before I come in the door. I think it's just unfair.
It feels like every single time I'm going to the doctor, or even a new doctor obviously I've had doctors that I've had since forever, but it gets to a point where I'm having to call my mom so that my mom can be like, no, you need to tell, and not everyone has that. Not everyone has a person that can be their bulldozer and be like, no, you need to tell them that they need to check this. Or even when I'm asking doctors, like, hey, can you actually like run all these tests? Like, can we check my iron again? Can we go through all these steps that I feel like I have insurance? There's an opportunity, and it does feel like I'm having to like advocate deeper for my care than my doctor is advocating for me at times. So that goes into, it's so important to really be selective about the doctors that you're picking. Yeah, because sometimes when you don't know, you're just going with who you've been referred to.
Correct.
Right.
And that in itself is very difficult. I think it's sometimes really hard to find doctors in your area that, it's hard. You kind of have to do a lot of research and really go into it, which does take a lot of time. And maybe for the average person, they don't have that time. So they're just going to it. But I do think it's important for people to know, hey, like if there's something that you want your doctor to look at, they should look at it. That should be a point to them to be like, if you're having this pain, we need to focus on this, or we need to focus on getting you back to a healthy point, or you shouldn't be living every single day like it's debilitating, or your period shouldn't be keeping you home 4 out of 7 days. Like you shouldn't be having to sit and work it from in the bed. There's all these steps that go into that. And I feel like that's such an important conversation to have as well.
What I want people to know is that this isn't some weird luxury where you're being too picky or difficult or whatever. Like as a physician, I want to give you permission to find the doctor that makes you feel comfortable, to find the doctor where you don't walk in where your heart is beating out of your chest because you're afraid that you're going to say the wrong thing or get gaslit during your entire visit. You have every right to be working with a physician or a healthcare provider who sees you, who values you, and looks at you as someone who is worthy of living a full and healthy life. If you don't have that, keep looking.
Yeah, a lot of patients feel like they have to go to where they were referred.
Yes, I'm one of those. I was like, I need to go there because that's what they said.
And I run a fertility practice, which does not really do any advertising. And we get patients because they went to where they were referred, left and had a meltdown in the car, and then found us on the internet.
Yeah, but also, or found it you word of mouth, because I've told so many people about
or Reddit, subreddits, TikTok.
Yes,
TikTok,
a patient
Chat
endorsement.
GPT.
I
said, what prompts did you put in there? They're like, best female Black doctor for infertility in Atlanta. I said, and that prompt got you to Moon Infertility? And they're like, yes. I'm like, okay, well, I hate to potentially disappoint you, but I'll give it a shot.
Yeah.
Right?
But
I love what I do. We wouldn't have sacrificed as many years of school if
Our
we
entire
didn't
youth,
love what we
largely.
yeah, forget about our youth.
Yeah.
And then when we get to the end point and we're finally doing the thing that I feel I was born to do, and to have people come in with all this medical trauma.
Yes.
Yeah.
It's so hard. It's so hard because I take care of a lot of medically complex patients who wish to become parents. Apparently, that is my happy place.
And we appreciate her.
Complicated.
I'm writing you down for when it's time. Don't worry.
Complicated Black women who are wanting to freeze eggs or become parents at some point in the future. They find me because those are the stories that have gotten told
Yes.
about me. Because
Yes.
finally somebody goes, "Oh, you're not telling me I can't get pregnant."
Right.
Right?
Yeah.
You want desperately to do this one thing, and my job is to make it possible for you.
And that is what matters. That is like the enthusiasm that you want your doctor to have.
Yes,
right?
that is exactly.
And
the energy that you both have is exactly what I want all of my healthcare providers to
right,
have.
I
want
wish.
to go in and to the point of being labeled difficult or complex. I think a lot of times, a lot of Black and brown women, when they go to their doctor, they have been dismissed on their pain or their level of pain, or if they're, I think women in general, when they go to their
Yeah.
doctor,
Yes.
they're
Yes,
like,
that is
it's
correct.
cramp. What, even when it's not cramps, you know what I mean? They're like, oh, that's just like, I don't know, your tummy hurts. And I've always said, like, hot girls have tummy issues, and that is like totally truth. But I feel like you still get dismissed as women, and especially
Yes.
women of color. You get dismissed so frequently, and
Well-
it is like so comforting to know that there are healthcare providers out there that do listen, that do care, that do have good energy, that want you to feel at peace, and like they're working towards a goal in mind. You know what I mean?
Yes.
To make you healthier, to make you feel good.
But to that end, it's the system that really matters, the system that we find ourselves in. The reason I had to go out of the system, set up my own practice, was because when you have systems that aren't set up to support the goals that you have for your patients,
Yes.
because if I was in an integrated practice, guess what? My panel was like 60% Black and brown. Because they went, hold on, you got a Black woman doctor on the, I want to go see that person. Because then they don't have to explain the layers.
Yeah.
They don't want to explain what life is like
Right.
being just showing up as a professional Black woman, because that's typically who comes to see me.
Yeah.
Right? They don't have that work to do. They could just jump right into, okay, so I was just living my life and then this happened. My periods are now absolutely miserable. Can you fix it? And can I leave my IUD in? And can I still freeze eggs while I'm working? And then we'll worry about the kids later. Like we live such rich, complex lives that the cultural competence, the systems have not invested in it.
No.
It takes time.
Yeah. And that's the thing. When I go to a practice and I see a black or brown doctor, I'm like, I want that doctor because I don't have to go. And I feel like I shouldn't have to do that. Do you know what I mean? It's like, it's sad that I have to do that because I don't want to be, I want to just not take off the layers so that
Yeah,
I'm not having
I
to be
know.
Give yourself
misunderstood
the
as
best
much.
chance.
Yeah, give myself the absolute best chance I can. And I think it's heartbreaking, especially for younger women that are,
Yes.
you know, you're going to the doctor for your first time. I remember when I went to my first pediatrician doctor, and I was like, this is horrible.
It's so
I was
scary.
like, I am so afraid right now. And you know what I mean?
So
and
that's me.
Yeah,
Sorry
that-
to.
that- I was
yeah,
like,
Yeah,
that's
I was like-
her.
And I think you said that so perfectly. There's always going to be a point where you step out of that protected pediatric world, right? Where people are so fun. They wear fun colors and it's bright and they've got toys and all that stuff. And then you go to the sterile land of adult medicine where there's like, why are you here? It's just like, what is this transition?
Yeah.
So
Yeah.
my subspecialty is pediatric and adolescent gynecology. It is my goal to be that first doctor that patients see when they're going through puberty and periods and they need someone to talk about this. And when I see them, I typically start by saying, I want you to know that you're in the right place. that you're not weird. This is not unexpected. This isn't inappropriate for your age. This is my life's work, and this clinic exists because I see patients like you every day.
Yeah.
The second thing I say is, you don't have to do anything you don't want to do today. I'm not going to do an exam or a procedure without your express consent, because you have consent over your body in this room and outside of this room, and I honor that consent. And I do that to model what the doctor-patient relationship should look like.
Yeah.
Adult gynecology, even with my like older teens, when we say you need to go see, a gynecologist that sees adults, they're like, no, because it is synonymous with, exams that don't make sense, things that are just accepted as painful, being dismissed, all of those things. And it has to be changed. And so I feel like we need to change it upstream by setting that standard that honors even our youngest people with periods, and then allowing that grace and that care to go upstream to everyone of all ages.
Big sister question. When should parents, guardians take their child, their daughter, to see their first gynecologist? Like, what's the beginning starting point for someone to come see you?
So the general guideline from like the American College of OBGYNs says between the ages of 13 and 15. The idea is that most people start their first period around the age of 12, and so we've got 2 to 3 years of periods at play already, where we can assess those and say, are we normal? Are we abnormal? Do we need to make changes? The only caveat to that is if you have a child that has any other complaints, periods that started earlier that were already painful, already bleeding too much, do not wait till 13 to 15. That's a general recommendation if everything's going well, but if you need someone sooner, get them in sooner.
Yeah. So circling back to where we first started, I talked about when I first got put on birth control. And that was around when I was around 18. So I've been on birth control for about 10 to 11 years. But I think a lot of times people just connect it with doing it for sexual protection. And the reason I was put on birth control is to manage period symptoms and to manage pain. So really my question is, when your child talks about taking birth control, it's not always to have sexual protection. I didn't even have sex when I was on birth control. You know what I mean? At that point, I was like, my periods are horrible. And how can we give guidance to parents, to guardians of being like, this is a point where maybe your child should consider these things. It's not always this one thing. I think everyone associates birth control with making sure that you're not getting pregnant, not thinking of all the added benefits that it can bring the younger generation as well.
And I love that you brought that up, because I'm constantly petitioning parents to like let them know of the non-contraceptive benefits of hormonal birth control. So part of my framing is that when I'm talking about this for period pain, for acne, for cycle regulation, all of these things, I typically call it hormonal therapy. I think it's a little bit of a misnomer to call it birth control if we're not using it to prevent unplanned pregnancies, especially when the patient in front of me is 12. Right? Yeah. Like, I feel like we need to call it what it is. So, for example, Tylenol. You can take Tylenol, right? Or acetaminophen for a headache or for a fever. If you take it, it doesn't mean you have a fever, right? And so there's multiple purposes for medications. And so I might say this is anti-fever medicine, or it's a pain reliever in this case. So I say just because you're taking this does not give you an indication that you do not carry. And non-contraceptive indications are very valid medical reasons to use something like a birth control pill or hormonal therapy to improve those symptoms. And so parents that get caught up on that, the stigma, the societal stigma of birth control, and say, oh my goodness, I don't want my child to use this, may be withholding the exact option, the exact medical therapy that'll help their child the most.
Yeah, so back to periods should not be heavy, painful, horrible, debilitating, life structure altering. If your child is staying out of school because of her periods, then maybe she doesn't need one. You need to talk to an expert, and maybe hormone replacement, hormonal therapy, commonly known as the birth control pill, is what she needs.
Yeah.
Because it will make heavy periods lighter. Why? It's not the ovary, it's the uterus, stupid. And, it's just getting hung up on the morality
Right.
The morality.
The false morality.
Of,
if you really call it.
medicine, right?
Yes.
I have to deal with this in my fertility practice. People come in and they feel like their bodies have failed them, and therefore they have failed their marriage, their partners, their families. And I'm like, whoa, 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 whoa. Do you feel the same way about high blood pressure?
Right.
Do you feel the same way about diabetes? No, what you have is a symptom of being a human who has the capacity to bring forth life. Imagine, nobody else has that power. Nobody else has that power.
Yeah.
Okay? And if the period is problematic, you fix the problem.
Right.
Yeah.
Right.
You know, you got a headache, you take your acetaminophen.
I do.
It's all right.
We've already talked about how I have been on birth control for over 10 years. We've really debunked, I feel like, just what your period's supposed to look like, if it affects your fertility, all the questions that really go into it. I think my real last question is, for someone like me that's been on birth control for a decade, over a decade, sometimes maybe even more, is there, how long is too long for your birth control? Or is that a myth that we obviously need to definitely debunk by the look of your faces? But how long is too long if you're on birth control? Or is that not something that we need to even be worrying about?
I would say as long as you need it to treat a symptom or prevent pregnancy or do both.
Yes.
In fact, it will affect nothing except for telling your brain to not control your ovaries. That is it. It will not lead to infertility. It will not lead to you all of a sudden developing conditions that just weren't there to begin with. It might be that when you stop the birth control, the reality of what your body's been living with gets unmasked. And now we see it for what it is. But for as long as you need contraception or to treat some other painful, horrible menstrual symptom, please take your birth control if it works for you.
Then that's coming from a fertility doctor. Hello.
Yeah, because I'm like, that's a valid question, because I think a lot of times online, people associate the two. If you've been on birth control for a while, you're going to have infertility, and that's just not that's not the truth. And you know what I mean? It's crazy.
In fact, I usually start an IVF cycle by putting people on birth control. You should see how big their eyes get. They go, wait, what? One of my medicines is birth control pills?
Yes.
And I go, yes, absolutely, absolutely, for 1 to 2 weeks. Yep. Because I want all your follicles to be marking time. Remember, because it stops the brain?
At the same time.
Marking time right there, ready to go.
Yeah.
So that when I'm ready to do what I need to do, which is take over to grow those follicles, I can do it.
It's a tool.
It's a
right?
tool.
Yeah.
It's a tool.
It's a
to help
chemical
you.
tool.
Yeah.
You know, better living through chemistry. We have all these drugs. They're all chemical tools.
Yeah.
They have a function and a purpose. As long as we understand what it is that they're doing. But no. Taking birth control will not make you infertile.
Summary statement.